Thank you very much, and welcome to you all. And I'm delighted. It's a real excitement and privilege to be able to welcome so many people from so many countries in the region and beyond to this symposium that's been a long time in the planning, and we're so pleased that it is now beginning. I also would like to say a word about some people who we would love to have had here today, but who haven't been able to make it. And particularly, there are 3 or 4 people from Syria who we had really hoped would be able to join us, but that's not been possible. I'd particularly like to start by thanking our partners and our hosts, the American University of Beirut, without whom this would not have been possible. We've worked with AUB now for 3 years, and it's been an absolute delight. But I have to particularly thank Professor Sibai and her wonderful team for realizing this and making the event happen, because otherwise we would not be here. I think my job is to explain in just a few slides what RESCAP-MED is, because it's just an acronym that you need for funding from EU projects. So I want to say a bit about what the project is and what we do, and a bit about its background, just for 5 minutes. There's our title, and I speak on behalf of the network as its scientific coordinator. RESCAP-MED is a project to build research capacity, and it's to build research capacity relevant to public health, particularly relevant to public health research, particularly in relation to non-communicable diseases. And we aim to create, through this, a network of Mediterranean researchers in particular core skills that we believe are necessary for public health research. And the key disciplinary skills that you will see identified there: epidemiology, environmental health, health economics, medical anthropology, and health policy analysis. And we've sought to integrate those 5 in the work that we've done. The work was has been funded by the European Union, to whom we're very grateful, for 3 years. And as Abla has just said, the project itself comes to an end at the end of this month. So this is our big finale. And it was funded, and I want to kind of emphasize this, it was funded under a call on the health and social determinants of health. And I think that emphasis on the social determinants of health alongside health itself is really important, and it reflects the themes that we're trying to cover both in our work over the 3 years, but also in this specific symposium. And we're coordinated by Newcastle University, which is the university I belong to. We are a network of 11 partners, and I've just identified them there, and I'm not going to run through the entire list, because it's with 11 partners there's quite a lot of us. But I've divided them up so that you can see that there's 6 academic institutions in the region, representing 6 absolutely crucial countries that have been in the forefront of all the events and dynamics of the last few years, in a way that we did not anticipate, of course, when we were writing the grant proposal in the second half of 2010. But, you know, Lebanon with AUB here, and then our colleagues in Jordan, Palestine, Syria, Tunisia, and Turkey. And it's been an absolute privilege to work with a group of extremely stimulating, talented, and inspirational colleagues. There's 4 partners from within the EU, all from within the UK and Ireland. So Trinity College in Dublin, and then the universities of Liverpool, London, and Newcastle, where, as I say, we coordinated. And then finally, we're very fortunate to have the participation of one international body, the World Health Organization's East Mediterranean Regional Office. And the speaker who follows me, Professor Jabbour, will in a sense, reflects that involvement. What we've done as a capacity-building project, we've run training workshops, both discipline-specific ones and writing workshops, writing for publication. We have a visiting fellowship program that has had, I think I'm right in saying that the final number will be 18 or 19 visiting fellows. We've organised 2 regional symposia, The first one took place in Istanbul 18 months ago and was focused on the social determinants of health, and this is the second of the two. And one of the aims that we've had in these symposia is, alongside keynote presentations, also to provide a forum for the rising generation of researchers. That's been, as a capacity building program in research capacity, that's been absolutely integral to what we've sought to do. And I hope you find that reflected in the program over the next couple of days. And then the last achievement and task that I want to mention there is that we set ourselves to develop an e-learning website and networking facility, which is run out of our partners at London University, and has led to the creation of a website that we will be talking about tomorrow, NetPH, that we hope will provide some continuity after the project and a resource for the region. RESCAP-MED evolved out of an earlier project, so that many of us have been working together now since 2009, and in fact a bit before, given the process of putting together the grant bid. But MedChamps was the first project of this network, and MedChamps was a research project also funded by the European Union, and it integrated epidemiological modelling, healthcare organisation and use, and health systems analysis, plus economic analysis of policy options. And we've sought as our overriding aim, I'm not going to go into all the aims, but the overriding aim was to provide the empirical basis for policy initiatives that would help to reduce the burden of CVD and diabetes in the region. And just a few points to mention about that. All the MedChamps participants are also participants in RESCAP-MED, but in RESCAP-MED we enlarged the network by, not least by bringing in our partners in AUB and in Jordan and the World Health Organization. And the scientific coordinator of MedChamps was Professor Julia Critchley, who will be speaking tomorrow. But in the early part of the project, it was also Professor Nigel Unwin, who's one of our keynote speakers too. So we're delighted to be able to bring Nigel Unwin back at the end of a period where he was instrumental in launching it. I want finally just to say a word about the symposium themes and our keynote presentations, which have been, as it were, built up around this kind of thinking. There's really kind of 3 points that I want to mention that were concerned to emphasize the epidemiological transition. So that's one core theme that we will be exploring, not only in keynote presentations, but in your presentations as well. The second is very much about health system analysis, and particularly health system fragility. And we're wanting to look at the capacity of health systems to cope with the enormous demands being placed by the rise in non-communicable diseases. But this is being done in a context that is absolutely extraordinary, and it's the social and political context that is the third part of this triangle, and that provides the particular focus for this symposium. One of the key parts about MedChamps, RESCAP-MED, and the symposium is the emphasis on interdisciplinarity, the fact that multiple disciplines have to work together in a context like this, and particularly to integrate the social and political into consideration of health. Too often they're kept separate, and the time is long past when that is remotely credible, and we hope in a small way that our project has assisted with that. And so it just remains for me to thank you and to say that I hope you have a stimulating and enjoyable conference. And I shall hand over now to Dr. Kronfel.